Hi, I'm Dr. Robert Weaver. I am the director and neuropsychologist of the Weaver Center in Wayland, Massachusetts. And today our topic has been coming up through many email questions about depression and attention deficit disorder. And one of the nice things about these videos is that people have been emailing me at robertweaver@weavercenter.org. You've been asking questions. It's really wonderful for me to respond and give you examples that I have that I hope will be really helpful for you in understanding, in this case for today, the intense emotions that can occur with attention deficit and why attention deficit is often missed because of the emotional experiences that people have, and that's what brings them to professionals like the depression or the anxiety. And often the attentional problems that may exist in folks like that are often overlooked because of the nature and degree of the emotional component that can often be there, and sometimes rather severely. So first of all, it's really important to know that attention, or any what we call frontal lobe difficulties with regulation of attention or emotion, or that those component parts, right, in normal individuals are very much affected by anxiety, depression, obsessions, and other kinds of things, so that by the very nature of emotions, people have problems with attention and concentration that are not ADHD, because ADHD is the neurological components of having a problem with paying attention, whether there's depression or not depression. So it's very important to have what we call a differential diagnosis, making sure that if the anxiety and depression are present, right, that we also evaluate the neuropsychological aspects of attention and concentration and rule those out so that the emotional problems can be treated first. And then if there's still attention problems, we can take another look at that. But today, what I'd really like to focus on is those that have had a history of attention deficit disorder, but do not recognize the symptoms or the problems that they have. And they also have a history or a family history of depression or anxiety or other emotional difficulties. So I have several examples of young college students where this often happens because they're not in a family context. They're independent and only up to others around them to identify or be concerned about emotions that they have. So one of the ways in which attention deficit and executive function, which is the planning and organizing and initiating difficulties that we have, occurs is that people have trouble getting started. And sometimes it's not trouble, it's an inability to initiate. An inability to initiate. And as we've talked about before, one of the reasons why folks with attention and executive function problems have that problem is because we don't feel the consequences of the behavior up in the moment that we need to get started, right? Everyone that doesn't have these problems gets started on things that they might not be interested at or good at or whatever, because they can feel the anxiety or the embarrassment or the disappointment or how bummed out they're going to be if they don't get to something. So that's what motivates people to get started when you don't have these difficulties. We don't have that chip. We don't have the ability to feel the consequences at the time when we get an assignment, in this case, in terms of college or some other thing that we need to do. So because we don't feel that until right before it's due, then we don't have the advantage of trying to avoid negative feelings to get started. And that's how other people get started. That's why we don't. We always think, oh, we got plenty of time. Things might as well be due next year if they're due in 2 weeks, because we don't have the feelings of the consequences. So what we need to do is to have strategies that work in the moment. But the consequences for this type of difficulty in terms of emotion and depression is that it's often the case that those of us who cannot get started because of attention deficit, that we put things off thinking we've got plenty of time. Like there's no intention. We know the consequences, but we don't feel the consequences. So what happens for many students that have a combination of attention deficit and a history or a genetic component, a predisposition to depression or anxiety, is students in particular, but adults also, they have a near inability to get started. It is so difficult to get started. And so when I was talking with, I'll say, Lucy last week, she was saying that she never really can understand why she gets into such a severe anxiety and then depression, even though people ask her, what do you get depressed about? What are you anxious about? And as we had further conversations, it was clear how hard it was for her to get started. And one of the questions that I really like to ask folks that struggle with this, they call it procrastination, of course, but it's not. In my opinion, I can explain that a little bit later, because there's no intention involved, is that I say, well, so how hard would it be for you to start something about 2 or 3 weeks earlier than when it's due if you didn't have this problem? And they'd say, oh, it would probably take me about 70% of the effort. That's what I ask, what the percentage of efforts between getting started and doing the whole thing. 70% of the effort would be required to get started because I don't feel that the avoidance of those impending problems with getting started. So then, if 70% is the amount it takes, I say, how long, let's say you didn't have this problem, how long would it take to actually get started? I don't know, a minute or two. So that's a pretty good ratio. If you can get rid of 70% of the effort in 1 minute, right? That seems like, wow, that would be pretty cool. Once I get started, 70% of the effort's over. But it also lets us know how difficult that getting started is in that moment, in that minute. So in this case, with regard to emotion, in this case, she is not able to get started. Things begin to pile up. The longer term projects start getting closer and closer to the end. It's a very, very short time before all of a sudden there is that flood of emotions, like I'm not getting things done, right? She would like to do a very good job at school, but now feels almost immediately overwhelmed, right? So the anxiety begins to amp up pretty quickly. And in her case, she can have panic attacks, which are very, very frightening, right? Panic attacks because she's overwhelmed with the amount of work that she's doing. She then often goes to a counselor or someone to say, I'm so anxious, I'm so anxious, I'm so anxious. The diagnosis, the temporary diagnosis is, well, she has a lot of anxiety. Maybe she needs medicine, treatment for anxiety, and so on and so forth. And not too far after, those things have not even been started or passed in, and the anxiety moves very quickly into severe depression. I'm lousy, I'm terrible, I'm never going to be okay, this is such a struggle. And the connection between attention and the emotions are not connected by professionals that see our kids a lot of the times, right? So it's very important that when you as a professional, or you as a parent, or you as a student, or you as an adult say, gee, I have so much anxiety, I have so much depression, you certainly may have a lot of emotional difficulties that are part of your makeup. But it's also important to be able to rule out the causes that are not just environmental. Oh, I'm overwhelmed, right? Because then people say, well, why don't you start earlier? Nobody gets it, or very few people get it. So it's really important to make sure that you get to, my bias, of course, is to be seen by a neuropsychologist that knows a lot about the emotions, knows a lot about the attention problems, but mostly we pay attention to the process of going from one place and one state, from one place to another. So of course, if you got some questions, please don't hesitate, or some examples, please don't hesitate to email me at rweaver@weavercenter.org, and I would be happy to respond the best I can, or put that on my list for our next videotape. So thank you, thank you, thank you. I appreciate your paying attention.